Are you curious about the optimal diet and supplements for brain injuries, the impacts of drinking alcohol, and whether you should be concerned about fructose digestion and absorption? We'll be digging into all of these topics today in this episode of the Energy Balance Podcast, a podcast where we explore health and nutrition from the bioenergetic view and teach you how to maximize your cellular energy to maximize your health. In today's episode in particular, we'll be going over how fructose gets absorbed and whether it's really a FODMAP. We'll be talking about whether you need to be concerned about excess fructose in foods. We'll also go over whether you should avoid sugar and supplement fish oil for brain inflammation, as well as diet and supplement suggestions for brain injuries, and also the impacts of drinking alcohol from the bioenergetic view. As always, to check out these show notes for today's episode, where we'll link to the studies and articles and anything else that we reference, you can head over to jfeldmanwellness.com/podcast. And with that, let's get started. All right, so our first question is from Garrett, and he says, you mentioned that fructose is much better absorbed alongside glucose, so I'm wondering if I can balance the glucose to fructose ratio by adding a bit of white rice to my higher fructose fruit. Would this also make the fruit not high FODMAP? So this is a great question. There's a lot of detailed things to get into here as far as how fructose gets absorbed in the intestines, whether we need to be concerned about it feeding bacteria and being concerned about it as a FODMAP as it potentially can be, depending on how well we're absorbing it. It can then go on to feed bacteria. So we'll discuss that, and also how you can determine if you need to be concerned about this in the fruits that you're eating based on the fructose to glucose ratio. And we'll also talk about why the typical categorization here of the fruits or foods that are excessively high in fructose isn't necessarily relevant. And there are some pretty significant issues there and disagreements we have in terms of some of the application of this. So we'll be talking about all of that, but as a starting place, we first just need to discuss how fructose actually gets absorbed in the intestines, because that will then inform how we can best absorb it and make sure that it's not being undigested and then heading on to, or unabsorbed and then heading on to feed bacteria. So Mike, why don't you start us off with that?
Sure. So I guess the first thing to understand is how fructose is actually absorbed in the intestine. And so there's two major transporters that control the absorption of fructose in the intestine, and it's actually a bit different than the absorption of glucose. So the major transporter of fructose in the intestine is GLUT5. So this is a receptor that takes fructose up from the lumen of the intestine and brings it into the intestinal cell. And then there's also GLUT2, which is seen with kind of like a co-transport with glucose that brings fructose again into the intestinal cell. And then also the GLUT2 moves the fructose from the intestinal cell into portal circulation. So you have these little receptors on the cells, or these little kind of transporters on the cells that take up the carbohydrates and move them across the intestine. Now, some things to keep in mind here is that the amount of these transporters and their functions are not stagnant overall. So basically, when you're exposed to higher fructose intakes, your ability to absorb fructose actually increases due to an increased expression of these different transporters and things along these lines. So basically, when you first start having fructose, you're not having a lot of fructose in your diet. When you increase it a bit, the amount that you'll absorb will increase over time due to changes in these transporters. At the same time, if there's a lot of intestinal inflammation and damage going on, you can also have a negative impact on the ability to actually uptake these carbohydrates due to adjustments in intestinal function related to some of the effects on these transporters. So the state of the intestine and the substrate that's being put into the intestine determine how well the intestine's able to absorb certain substrate like fructose. And fructose is a little bit different than glucose, because in a large proportion of people, the ability to absorb fructose can be a bit impaired without having adequate amounts of glucose present. So if you don't have adequate amounts of glucose present, the ideal ratio is 1-to-1 glucose to fructose. And now, when you start to get over that, when you start to have more fructose over glucose, so the ratio becomes in favor of fructose, that's where you start to see people have issues. But there's a wide range of tolerance. Some people, 5 grams of fructose is a problem over glucose. And other people, it's upwards to 50 or more grams of fructose in a sitting. So there's also this individual variance in response to fructose overall. And so there's a lot of moving parts going on. For myself personally, the way I like to determine with clients how this works is, I'm not trying to do a test to measure their GLUT5 receptor activity. It's more just how much, like, you have foods that have higher or lower fructose, and you see if you have a negative response to them or not. You want to make sure that it is like a fructose component, because as I'll talk about, some of the high fructose containing foods that people tend to have issues with also have FODMAPs. And so with that said, you want to make sure it's not the FODMAPs like a sugar alcohol like sorbitol that we would see in apples, or versus the fructose itself. And so to answer this question specifically, can you add a bit of glucose in the form of maybe dextrose or white rice to other foods that are higher in fructose, and it will help to improve intestinal absorption of fructose? I think so, especially if your tolerance for it is low. You're one of the people close to that 5 grams of fructose over glucose. But at the same time, if the problem is not fructose related, if it's more of an issue of a FODMAP, like a sugar alcohol like sorbitol, or lactose, or whatever lactose wouldn't count, but it's more of a function of one of these FODMAPs, then the adding sugar or adding glucose wouldn't necessarily help that. It's just in the case of fructose. That's why it's important to understand with the different foods what type of fermentable fibers they have in them as well. The other thing I want to mention here is the major problem that I see with fructose malabsorption, especially, so with fruits, I think this is less of an issue because of the polyphenol compounds and fibers present. But when we look at the studies and you do a bunch of free fructose feeding, or you have high sources of free fructose that doesn't have a lot of polyphenol components and fibers, then the bacteria in the gut with the free fructose feeding can start to produce endotoxin, and this starts to create inflammatory responses and issues overall. So that's kind of that would be my rundown on fructose specifically.
Yeah, and when you're talking about the free fructose in that latter context, you're talking about excessive free fructose over the amount of glucose present, right?
Well, I'm saying even if they were just to feed them pure fructose, because that's what happens in the studies, is like, here's a 75-gram bolus of pure fructose in a solution, and let's just see how it goes. And it's like, it's probably going to go bad for the vast majority of people when you look at the fructose malabsorption studies. And then to try to understand what's going on metabolically without understanding that piece is pretty questionable, because it's like, this is not about absorption now. This is about how are you dealing with endotoxin and malabsorption of fructose in the different studies.
Right, exactly. And that's pretty much never going to be a good thing. And so that's what even led to, is one of the main things that have led us to talk about this previously, is looking at the sugar and fructose research. In the vast majority of time, whether it's for rats or humans, they're giving free, pure fructose way in excess of glucose, or sometimes with zero glucose, as you said. And then this is a question of just purely feeding bacteria endotoxin production and the impacts of that, rather than it having anything to do with fructose. And so that's what has led to, I think, the question of that's being asked here, because as we said, you need to have glucose alongside the fructose to absorb it. And so just to get into that in a little bit of detail, as you said, there are 2 primary receptors that help to transport fructose in the intestines. There's the GLUT5 and the GLUT2. The GLUT5 is always there, and it just transports fructose, and it's a pretty low capacity relative to the GLUT2, which has a much higher capacity for transporting fructose. And the GLUT2 receptor is basically recruited when a different receptor, the SGLT1 receptor, is active and is transporting glucose. So that's what that is why having the glucose alongside the fructose helps. Basically, it increases the activity of the SGLT1 transporter, which then helps to recruit the GLUT2 transporter, which allows for increased fructose absorption. And this is important, right? This is why feeding excess fructose can be an issue. But as you were saying, the amount of excess fructose that is an issue will vary considerably, right? Could be as little as 5 grams on the much worse side, or as high as over 50 grams on the other side. And it's going to vary, as you said, based on gut health, bacterial issues, general inflammatory state, thyroid function, metabolism, all of that. And so that then, when we're looking at specific foods, we need to consider all these things, right? We need to consider our particular tolerance. As you said, testing is generally the best way to identify that. But the problem with testing, as you said, is most of these foods that have excess fructose don't only have excess fructose. They have other potentially fermentable carbohydrates as well. And a good way to test it would be exactly what Garrett was saying, which is you bring in some extra glucose alongside it and see if that helps with the digestion symptoms that you're getting, let's say from an apple. If it does help, then we know in our case it was an excess fructose issue and a fructose malabsorption issue. If it doesn't help, then we know some other fermentable carbohydrate or some other aspect of the food that was causing the digestive issue. So that's kind of the big picture concept here. It's also worth mentioning that so having the glucose to fructose in a 1-to-1 ratio is almost always enough to fully prevent any fructose malabsorption. But there's actually, like, you can get away with a bit more than that. So because of the way that the recruitment happens, you can get away, let's say if you have 25 grams of glucose and a little bit extra fructose, let's say 30 or 35 grams, that is often better than just having the 5 to 10 grams of free fructose with zero glucose. There's the glucose helps in more than a 1-to-1 ratio, but again, it's really hard to identify because of the way that the studies are done. There's so much different variability in the different protocols and the people that are being looked at, and there's just such variation there, which is why you have a range of anywhere from 5 to over 50 grams of free fructose before it becomes an issue. So a lot of variables here, but it's also worth considering that if you're eating something that maybe it has 5 to 10 grams of excess free fructose when you're having 60 grams of carbs, that might not be an issue, even if you have an issue with 5 to 10 grams of pure fructose. Although also, how do you even know that unless you were just trying pure free fructose, which almost no one does. So just different kind of intricacies here that are worth considering. And but it is worth, again, mentioning here that having some glucose is very helpful. And so that then brings us to the question of, is this an issue with different foods that we might be eating? And normally when it comes to the fructose to glucose ratio, this is one of the biggest issues I have. I mean, when it comes to the general idea of FODMAPs, it's a great idea, but in practice, I think there's a lot of, or in application, I think there's a lot of missteps, and this is one of them. A lot of times when looking at the fructose to glucose ratio, only free fructose and free glucose are considered, and the other carbohydrates like sucrose are not considered. And that makes a huge difference because, and we'll get into this with something like a mango, which has a lot of sucrose and much less free glucose and free fructose. If you just look at the free values, you're going to have a ratio of fructose to glucose of almost 3. But if you add in the 50% glucose and 50% fructose that you're getting from the sucrose, you then have a ratio that's just over 1. It's like 1.3, almost 1.4. And so that's something that's really important to consider when you're looking at the carbohydrate composition of the foods, that you don't only consider the amount of free glucose and free fructose, but also the amount of glucose and fructose that are in the sucrose that can be in the foods. So that's one thing that's important to consider. And with that in mind, when it comes to fruits, there are really only a few that have a pretty high fructose to glucose ratio when sucrose is considered. And this would be pears, apples, watermelon, and mango. But there's a pretty huge variation between them. So when we're looking at apples and pears, the fructose to glucose ratio, all carbs considered, ends up being around 2.5. And so just one apple or just one pear could be enough to get your 5 grams of excess fructose, which, if you are compromised gut-wise, could be an issue. If you're not compromised, and as you were saying, Mike, you're used to consuming carbs, like you normally consume carbs, including fructose, or even just glucose, you're going to be better at absorbing it, and 5 grams of free fructose probably won't even be an issue. But if you are sensitive, just one apple, just one pear could be enough. When it comes to watermelon and mango, the fructose to glucose ratios are about 1.3 to 1.5. So nowhere near as significant as apples and pears, but enough that if you're having a pretty decent amount of carbs from those things, you could get 5 to 10 grams of excess fructose. But it would really require, if you're trying to get 10 grams of excess fructose, you would need over 50 grams of net carbs from watermelon and over 65 from mango. So we're talking about pretty high amounts of carbs here, net carbs, in order to actually get to a level of excess free fructose where it's an issue. So if we're sensitive, we might want to keep an eye on those types of fruits. If we're not sensitive, then it probably won't be an issue for you. So that's something that's really important when we're talking about any food, any sort of carbohydrate or other type of food that can cause digestive issues when we're compromised. And when it comes to choosing foods, creating a diet with that in mind, I've created the Energy Balance Food Guide to help you determine exactly what types of foods will work well if you're compromised in terms of your digestion. And if you're not, what kinds of foods will work well in terms of supporting your metabolism and allowing you to improve, sleep, hormones, digestion, increased energy, all those types of things. Basically, the Energy Balance Food Guide, it's a one-page infographic, and it organizes foods on a spectrum based on how effectively they support your metabolism, and it has a separate spectrum that adjusts the scale in the case that you are dealing with digestive issues like the ones that we're referring to. So you can head over to jfeldmanwellness.com/guide to download that free Energy Balance Food Guide. And that leads me to just one other food that I wanted to mention to consider when it comes to a high fructose to glucose ratio, and that's agave syrup. And agave is often used as a sweetener because it's very low glycemic, and it's low glycemic because it's really, really high in fructose, but it's really easy, especially because it's used as a sweetener, to have excess fructose when you're consuming agave. And I've seen that in people, especially who are already having digestive issues, that then they consume something that's sweetened with it, or they see it and they're like, oh, that's low glycemic, and so it must be healthy, and it causes a lot of digestive issues. So that's definitely one to be aware of when it comes to the fructose to glucose ratio.
Yeah, a couple of things I want to add specifically is that even if you don't have a problem with the excess free fructose for watermelon, mango, pear, and apple, the other FODMAPs in them, so fructins, which are like chains of fructose, like fructooligosaccharides or something like inulin, and then also the sugar alcohols are still a pretty big concern for a lot of people who have digestive issues. And so even if it's not a fructose issue, it could specifically be a FODMAP issue. And people who are dealing with digestive problems, like you have, bloating, gas, IBS, SIBO, things like this, those fruits are still going to be an issue even if you don't have an issue specifically with fructose. And also people coming out of a low carb diet, they're coming from carnivore, they're coming from keto, they're coming from low carb paleo, will still likely have problems with those foods because of the FODMAPs. And also for those people, there's a transition coming out of those diets where gut function has to upregulate to deal with carbohydrates versus the fats, and probably shift the microbiome in the colon and all of these different components, and also have the liver kind of adjust and the body adjust metabolically to the carbohydrate. So you may find initially that you will have a negative effect with some of these, especially the ones that you mentioned, Jay, agave syrup, pear, apple, watermelon, what was the other one? Mango. So you'll see the effects with those foods, but over time, as you expand the dietary sources, you get to tolerate carbohydrates a bit better. You'll probably find that your tolerance will increase and the amounts that you may be able to have will increase. But if it doesn't, some people just don't do well with certain FODMAPs. Like there's quite a few people I work with where it's like mango is just not going to be a good option in large quantities because every time they have it, they get bloating and gas. And so you may be able to have some, but there's also the point that you may never really be able to tolerate it super well. And again, that's because of the FODMAP. And that doesn't necessarily mean you have a gut dysbiosis or that your intestines are impaired or that you have IBS. It's just that you don't do well with those FODMAPs. The microbiome is creating symptoms for you. And there's not really anything specific to do about that unless you want to start playing around with the microbiome and see if that makes a difference. But for a lot of people that I've worked with and in my experience, I haven't seen people tolerate some of these foods super well in the long run. And it's not even a fructose problem, it's a FODMAP problem. So I think when looking at these things, it's always important to understand context, like where are you at right now? And then also your individual variability in response to different foods. And this plays out as well with other foods. As an example, like I can tolerate, for example, broccoli fine, which does have FODMAPs. I don't get bloating and gas from it. But I get pretty bad bloating and gas from something like yams, and the FODMAP content and fiber is very different, and then the microbiome interacts with it in a different way. So these are all important things to understand with this overall.
Totally. And that's, I think, part of what falls short with the simplified kind of low FODMAP approach. I mean, even just the fact that fructose is universally considered to be a FODMAP, which I think is something we need to be careful with, just like we're describing. Like it takes a pretty decent amount of these foods to get any excess fructose that is normally known to cause an issue. So Same with lactose. That's another one on there where our ability to digest and break down lactose can vary considerably and improve as our gut health improves, thyroid health improves, can also improve based on what we're consuming with the lactose. So having sugar with the lactose actually helps us break it down and absorb it. So there's so many things like that to consider that we don't want to have some sort of rigid idea around those sorts of carbohydrates being an issue. And as you were saying, Mike, as well, there's a ton of other types of FODMAPs that may or may not be causing an issue. So those would all be things I'd be thinking about, things I would consider. And again, coming back to the question, just to wrap up, trying a bit of glucose, whether it's dextrose or white rice, alongside the foods would help to rule out whether or not it is a fructose issue and help you identify if it is maybe a different FODMAP that you're struggling with. The other thing I wanted to mention there is there's certain things that are not considered when it comes to FODMAPs that may potentially be FODMAPs, depending on your digestive capacity, and starch is one of those. You may or may not effectively break down starch, and there's different types of starches, and we've talked about this before, amylose, amylopectin. We talked about resistant starches in a recent episode that I'll link back to. And so that's a whole other area that we would also need to consider. And so again, there can be complexity here. It can definitely, I guess it requires the nuance and understanding of these things in order to effectively make the changes and tweaks so that you can identify what sorts of foods might be feeding bacteria and causing issues for you.
Yeah. I think the implementation there too, just to wrap up, is get yourself down to a relatively baseline setup that minimizes a lot of problematic foods. And then instead of kind of ideologically cutting things out, oh, it has FODMAPs, oh, it has casein, oh, it has salicylates, oh, it has oxalates. Give some of the things a test to see how you respond to them. Because the other problem that I think people run into is when you start to set up your diet and you create all these theoretical kind of boundaries around what you can and can't eat, what you wind up running into, and we see this all the time, like we were having a conversation last night about endothelial dysfunction. And it's like, well, glucose increases it, and it's like, and then fructose doesn't, but then fatty acids do as well. And it's like, so you don't, like, what do you eat? And so that's, I think, the problem that people run into with all this stuff is, well, I can't eat salicylates, I can't eat oxalates, I can't eat FODMAPs, I can't have carbs, I can't have saturated fat, I can't have polyunsaturated fat. So it's like you just get protein and monos left. And it's like, well, then you can't have protein because mTOR. And so I think with a lot of this stuff is like the theories are interesting to think about and they're helpful to be used as a guide, but you want to really be putting this into practice and testing out how you respond to these different components and structuring the diet from there. Because if you get too caught in the theory and ideology, then what winds up happening is you can paint yourself into a box that you don't have any sustainability or sustainability or the ability to actually implement the diet effectively, because there's just too many rules that some of them are actually relatively arbitrary. And so for me, I see this I get asked by clients all the time. It's like, well, this person says that I can't eat this. And it's like, well, how do you do with it? It's like, well, I do pretty well and I feel good when I eat it. Okay. Is it corn oil? No. Okay. Is it a bunch of like really terrible processed foods with industrial additives? No. It's like, oh, it's sweet potatoes. Oh yeah, I do. I really enjoy them and I do well. It's like, okay, well, if you're not having problems with them, you're tolerating them, you like them. Maybe they have beta carotene and the low vitamin A people will say that's terrible. And maybe they have oxalates and the oxalate people will say that's terrible, but you're doing well with it. It's part of your diet. You have it all set up, then run with it. It should work fine. Where we should be able to eat some of these foods. It doesn't only have to be 2 steaks a day with salt and water.
Yeah. Now, obviously, I'm trying not to get on too many tangents with each of those different possible avenues opened up. But I think, so what you mentioned in a bigger picture sense is when we get stuck with rigid rules and a yes and no kind of black and white sort of perspective, that is what can cause us to run into trouble, as opposed to listening to ourselves, identifying how we feel, and building a deeper understanding of why or whether or in what circumstances these things could be an issue. In this case, we're focusing on fructose. Same thing could be talked about in terms of anything from, as you were saying, beta carotene or oxalates or anything else. There are different things metabolically, different pathways that could leave us susceptible to these causing issues. We can work on those and improve those so that they're no longer issues or much less likely to be issues. There's so many details and things that are important to understand if we are going to get into the physiology that allow for the nuance. And so we want to be careful about just getting that surface level information of this thing could be a problem and not understanding the context around it, because then we lead to what could be a very restrictive diet. And that's not only an issue from the psychological side and the enjoyment side, but it can be a major issue from the health side. Like we don't want to just remove things just in case they could be an issue, because then you will miss out on a lot of really beneficial things. So it's,
and you won't be able to
a
eat.
word of caution.
You won't be able to eat because you're
Right.
like, you have all of these structure. And that, for half the battle for me working with a client, is like trying to expand some of the options. And so
Sure.
you start at a diet that's like an elimination diet, but it's like, you still have fruits, you still have cooked veg, you still have starches if you're tolerating them, you still have dairy if you're tolerating it. And then you kind of like expand from there based on how you're feeling and what you respond to. And so you're only starting at this one place just so that you can get like an objective perspective on where you're at. And then you open things up from there so that you can see what your personal tolerances are. And the other thing is, you and we could talk about all these theories, and they're great, and they can be guiding principles for you to understand why you're not responding well to something. But at the end of the day, the ultimate arbiter of whether or not something's going to be incorporated in your diet or not is going to be your response, how you're feeling, how you're functioning. And with these guiding principles in mind, but it's not just the theories, it's like the practice and the theories together, and you're moving back and forth between them. You're moving back and forth between the map and the territory instead of just relying on the map or just relying on the territory. So we want to kind of use both. That's, I think, the best way to go about it, and that's how you get the most effective response, because there's so many things that we don't even know in terms of how they interact between microbiome, hormones, genetics, inflammatory signaling compounds, neurotransmitters, all these environmental factors. So there's a lot of pieces moving simultaneously, and we're still figuring all of this out as like a society, both myself and Jay as well. So it's like, we need to rely on like what we're seeing in practice, because there are blind spots in the theories that haven't been uncovered yet. And so, I don't want to go too much further on the tangent, because I know I took us on the tangent, but I think that's important to understand with this stuff, because I see that as a big hang up with a lot of people that I'm working with on a regular basis.
Yeah. Yeah, definitely. And we'll leave it at that, and maybe link back to some prior episodes where we've talked about experimentation and the value of our experience. I'm sure there's been quite a few of those. So we'll link back to those longer discussions. And let's move on to the next question. Do you want to read this one off, Mike?
Sure. So Lexi says, my 8-year-old has had 2 concussions, and now we are pursuing a PANDAS-PANS diagnosis. Regardless of the diagnosis, we are seeing many symptoms showing neurological dysfunction. Pretty much everyone and everything I'm reading is saying to go on an anti-inflammatory diet, cut out all sugar in caps, and use fish oil to lessen all the inflammation. The one doctor says in his book, it must be fish oil and no other animal oil like emu, because only fish can penetrate the blood-brain barrier. I've been a close follower of metabolic health for several years now, and I feel really confused. Any advice? If not going off sugar, what can I do diet-wise to help the obvious brain inflammation? What can I do instead of fish oil? This is the common narrative for helping children with neurological differences, or I think maybe dysfunction, and it saddens me. So I don't know if you want to jump in on that one, Jay, and start us off with how to actually manage cognitive dysfunction or neurologic dysfunction after a brain injury.
Yeah, I think we'll definitely talk about that. Maybe we'll even just start with this idea of the anti-inflammatory diet, right? This is something that, and we won't go too far down this path, but something that's talked about a lot. And we have the typical cut out sugar, often cut out dairy. In this case, we're talking about also adding lots of fish oil and omega-3s. And we've talked a lot about sugar and carbohydrates, so I won't go too far down the path of why they're not inherently inflammatory. And instead, I would say largely the opposite, right? Carbohydrates, including sources of sugar like fruits and honey and maple syrup and even some granulated sugar, are incredibly beneficial and anti-inflammatory when we're using them well and in decent amounts and a balanced diet, all of the caveats, of course, that we've made historically. And so I don't think it's a good characterization of an anti-inflammatory diet. An anti-inflammatory diet would include carbohydrates, including good quality sugar sources. And on the omega-3 side, it's a side that we would want to be really careful, especially when we're talking about brain health, and especially when we're talking about injury and states with high amounts of inflammation, damage, and oxidative stress. Because that's when, there's that kind of reactive state is always going on in any cell and any tissue, because there's a lot of, we're very active metabolically. We have a high body temperature. So there's always potential for damage and whatnot. But if you are in a highly oxidatively damaging state, we want to be even more careful. And we talked about this in a number of different episodes talking about the omega-3s, but the omega-3s are more susceptible to damage and oxidation, lipid peroxidation, than any other fat that exists that we can consume. And we want to be really careful about that. We don't want to be having high amounts of damaged, oxidized omega-3s in our brain. That's something that we see in various degenerative states when we're talking like Alzheimer's and Parkinson's and all sorts of other issues, situations where you have damage in the brain, you see damaged omega-3s, and providing more omega-3s to a state like that is, I would say, dangerous, I guess. It's just adding something really flammable to a fire. A fire that is already there in this case, let alone a case where there's lots of sparks to begin with. But yeah, so I think we've talked about this a lot. We've talked through studies showing that the omega-3 consumption causes lipid peroxidation just through the digestion, even just when they're sitting on the shelves. Typically, there's already peroxidation that's gone on, happens in our digestive systems. And then once it's absorbed, it happens as well. Like we see increased levels of peroxidation as a result of the consumption of the omega-3s. And we cited tons of studies and pathways describing this, some that are really well established, like the pathway of how omega-3s lower cholesterol production through lipoproteins in the liver, how it lowers LDL is basically by causing oxidative stress. And so, yeah, it's pretty clear there. And with that in mind, I would have caution about the idea of using omega-3s or fish oil in a situation like this. Which then brings us to the question of how do we actually create an anti-inflammatory state in the brain or anywhere? And in general, the answer there is going to be providing ATP, a low reactive oxygen species production generally, or at least a high ATP, high carbon dioxide environment, and one where we're effectively producing energy. That's how we heal. That's how we repair. That's how we keep inflammation down. Inflammation is basically just a signal that is saying there is damage here, and we need to activate our backup repair systems to try to resolve the damage that's going on, to try to resolve the energy deficiency that's existing. That energy deficiency can occur due to an impact, due to injury, or due to a metabolic issue, or any number of other things. And so what we want to do is maximize the metabolic state, which would involve avoiding things like the omega-3s and making sure to consume good sugar sources. And there is a number of supplements that we could use and other interventions that we can use that would help with metabolism in general and specifically in the brain. And so those would be ones that I'd want to focus on. And so this would be things like some of the protective steroid hormones like progesterone and pregnenolone, which can have a lot of benefits in the brain, can also increase the production of allopregnanolone, which has a lot of benefits in the brain. And progesterone specifically has been shown to be extremely protective and allow for repair and regeneration after brain injury. So those would be things that would be on my radar. I'd be thinking about something like methylene blue, which has also been shown to protect the brain against injury or after injury and allow for repair regeneration. I would also be thinking about something like carbon dioxide, ways that we can increase it. We've talked about this in previous episodes, so I'll link to those. This could be different breathing techniques like Buteyko breathing or bag breathing. And it could also be trying to create like high carbon dioxide environments, which would all be things I would be considering here. And other things I'd be thinking about would be when it comes to healing and regeneration, something like red light, which again, there's so many details there, but that's something I would consider and look into. And then there's also, when it comes to our metabolism and effectively producing energy, the B vitamins are incredibly important. So I'd be considering a number of different B vitamins, but more specifically, there's a form of vitamin B1 that more effectively crosses the blood-brain barrier. That's called L-thiamine. And so that's one I'd be considering as well.
Yeah. Yeah. In terms of the anti-inflammatory diet and the omega-3s, I think with the omega-3s, one of the main mechanisms by which they're working through is blocking the inflammatory enzymes, so cyclooxygenase and lipoxyoxygenase, and then also shifting eicosanoid metabolism. So the eicosanoids are the inflammatory mediators. And so you can do this without having to use a highly lipid or peroxidizable fatty acid. And a lot of this stuff is centered around polyphenolic plant compounds, which block cyclooxygenase, block lipoxyoxygenase. They also shift what's going on with these inflammatory mediators, and they block some of the major inflammatory pathways in the body, like nuclear factor, kappa beta. So these are things like incorporating fruits and some of the vegetables in the diet, which you would see in the anti-inflammatory diet, except they wouldn't have fruits. But I think the fruit is extremely important, and the sugars, as you mentioned, because the number one, the fruits have very potent and important plant compounds, and the sugars are important in providing energy substrate for the brain to produce that ATP. And when you have a brain injury, what winds up happening is when you damage that tissue, you get these areas of swelling in the brain. And it's like the water in that area becomes unstructured because the damage, because the metabolic metabolism has been impaired. And so fixing that, providing the carbohydrate, providing lowering the inflammatory state with some of the polyphenolic plant compounds, and also providing the vitamins and minerals so those things can work effectively, like thiamine, so that you can use the carbohydrates in the mitochondria, particularly the fat-soluble thiamine. These things are extremely helpful in this point in time. And then, so that the focus on my end would be shift towards, have the carbohydrates, have the fruits, have some of the juices, especially for an 8-year-old kid. Let them have some of these things. Make sure they have a decent nutrient density in the diet and things along these lines. And then if you still want to hedge and you're really concerned about the omega-3s, incorporate seafood in the diet. Shrimp, mussels, some clams, if you have oysters here and there, if you have scallops, if you have some fish in the diet, incorporate like cod, sole, flounder, etc. Incorporate those, because number one, they're going to provide vitamins and minerals that are going to be lacking from the diet otherwise. So things like iodine and selenium. So those things would be important. That will be important for lowering ROS, because the selenium is involved in the enzymes that produce glutathione, which is one of the major antioxidants in the body that will help to control reactive oxygen species in the brain in that damaged area. You get a good protein source. And then you also, whether or not the omega-3s from the fish are super beneficial, them being rancid, like super rancid and peroxidized, is probably going to be less of a concern than like taking fish oil caps, which is very likely to be already rancid, even though the digestive process may adjust and create some rancidity or lipid peroxidation for the omega-3s. So I would still, regardless of the stance, I would always hedge with seafood over the omega-3s that you're purchasing on the shelf, because of the peroxidizability and because the fish itself has benefits that I think are beyond what's going on with the omega-3s. So I'd incorporate the seafood in the diet. The other component, so we have carbs, we have some seafood, we have the plant compounds, the carbs would be the fruit sources, and we have the different plant compounds that would come from those. I'll talk about some specific ones. But then the other thing that we want to do is they say no carbs at all in this anti-inflammatory diet, because we want to get ketones in, because ketones have all this benefit. And it's like, okay, incorporate some coconut oil in the diet. Or if you really like, incorporate some MCT oil in the diet, and you'll get some ketones without having to drop all of the carbohydrate content. And again, the insulin signaling in the carbohydrate content is extremely important to provide NADPH for glutathione production as well, which is going to help control the reactive oxygen species. So an anti-inflammatory diet could include some seafood types that I mentioned, some fruit sources and some juice sources, maybe some starch sources that work well. And it also can include some things like the different plant compounds, and then maybe some coconut oil or some MCT oil in the diet. If you wanted to still get some of the benefits in these other areas and still incorporate the benefits within components that we are talking about. Now, with that said, with the brain injury element, like for a child as well, for an 8-year-old, like red light is a low hanging fruit option, because you don't have to worry about the supplements and all this type of stuff. And like, oh, the neurosteroids in a kid, what's the effect? We don't have all the research on it. So you can do the diet plus the red light component. And I think those things would be super helpful with like very, very low risk for a child in this circumstance. Now, somebody like an adult who has brain injury, the things that you mentioned, Jay, are great. There's a variety of options that have either preclinical studies or clinical studies showing benefit. So we have things like vitamin D3, vitamin E, and vitamin C to lower the reactive oxygen species, help protect against lipid peroxidation. You have the B vitamins. You have the amino acids, glycine and taurine. Then you also have something like CDP choline or acetylcholine, which has been shown to help with brain injuries. I think in clinical studies, we have methylene blue to help improve metabolism, which will actually synergize with the red light and will also synergize with the thiamine, because the methylene blue will be the electron acceptor in the mitochondria. The thiamine will increase pyruvate dehydrogenase to allow carbs to go in, and then red light will help with the water structuring process and also help with cytochrome C oxidase function inside the mitochondria as well. So essentially, they will synergize together, have pretty significant benefits. And then you have the neurosteroids that you talked about, Jay, progesterone and pregnenolone. And then in terms of some of the polyphenolic compounds, some options here as well would be something like pycnogenol, curcumin, boswellia. These will all block cyclooxygenase and lipoxyoxygenase and have microbiome modulating effects to lower endotoxin, things like this as well. So they would be beneficial to help control the inflammation. And some of them have even been tested in brain injury models in animals. And I think some of them have even been looked at in humans. The last one I'll mention briefly is this hasn't been tested in the TBI models, but there are certain compounds. This is the most benign. The other ones are a little bit more experimental. I'm not going to bring those up, but you can use something like lion's mane to possibly increase BDNF a little bit after brain-derived neurotrophic growth factor after brain injury to see if that can help move the needle as well with the recovery process. So there's a variety of options available besides just fish oil. And as a side note, when I was working in a brain injury unit in the hospital, and I was a neuro unit, I was seeing patients who had gotten pretty severe brain injuries get fish oil pills on a regular basis. So it is a thing. They are using them in certain ICUs, but overall, I think that there's a bunch of other strategies that I would consider. And for a child, I would situate the diet really dial in the diet, because I think that's going to be one of the lowest hanging fruit, safest options available, and also incorporate the red light. And then the supplements, you have to really weigh the risk with a child. So an 8-year-old, they're not fully developed. You don't know how some of these things will affect. But I think the frame that we're coming out with the sups is more so for an adult, for an older individual with a brain injury, where there's not really a worry about the effects of these things on development or something like that. And again, these are all relatively safe. It's just kind of like we had that disclaimer has to be there. So just things to consider overall.
Yeah, I wouldn't rule out the usage of any of these things based on age, but I would just make sure that someone does their due diligence before implementing anything like that. And of course, we are not recommending that they are used without regard for that. But I think they would still all be on the table. They would still be on my radar.
Yeah. The progesterone specifically, there's some really interesting studies where it shows after acute brain injuries, it really helps with brain swelling, which is one of the biggest problems, because you have a skull that has a limited volume and you can't really fit much more into it. So when you have the brain injury, you start to swell. That's where you start to see serious issues. And I think just the pressure alone can create problems inside the brain tissue. And so you having something that helps with that is super, super useful overall. And progesterone is one of the things that they were looking at for that.
Definitely. Yep, definitely. Two other things I just wanted to come back to. So I think you mentioned the ketones, and I would say one of the most important things here when we're talking about having the brain in a good anti-inflammatory state is having enough fuel to produce energy with. And that is going to be glucose unless ketones are provided. And shifting into a ketogenic diet will lead to periods of time with a lack of fuel available for the brain. And in order for the brain to get just the amount of fuel that it needs, we need to rely on constant ketone and glucose production, which is, I would say, a much more suboptimal situation than providing adequate amounts dietarily. So if you wanted to make sure that we were getting any possible benefit of ketones, and you wanted to add in, as you said, coconut oil, MCT oil, or exogenous ketones, I think there would be no negatives to that. But I would say there would be potential negatives to avoiding carbohydrates. So 100%. That would be the approach that I would take there. In talking about the omega-3s, I think in this case, we're better off without trying to consume them, or without consuming any amounts beyond what we would get in a normal healthy diet. And so if you're consuming some seafood, of course, you'll get some. It's still, unless you're consuming the very high PUFA seafood, like, salmon, you're still not going to be getting very much omega-3s from, shrimp and oysters. There's a bit, but not much. If you're trying, so I think if you are trying to get considerable doses, if you're trying to get multiple grams of omega-3s in a day, and you're debating between fish oil and fish, I guess I would say maybe fish is a tad better, but I really think we're talking about the same beast here, and that's not an approach that I would take. And again, so it's like if you're trying to get half a gram or a gram a day, you're probably going to get that anyway from consuming good quality seafood and meat and dairy anyway. So I would caution against trying to get large amounts. I don't think that makes sense. I don't think that's a good idea.
I don't even think it. I think that, again, like the mechanisms that they're seeing the effects for that is through changes in the icosanoid pathways and then shifts in the inflammatory mediators. So it's like if you were just like, so say you came from the perspective that maybe there's this really small requirement for DHA, deoxyhexadecanoic acid. It's like, okay, you're going to want to have high quality seafood in a diet anyway, in terms of the things that we mentioned. So, okay, have those sources. There's benefits to them beyond the whatever amount of DHA they contain, but to super dose omega-3s, probably not an ideal circumstance, especially if the mechanism you're looking for is through shift in inflammatory mediators. That can be achieved in other ways without the lipid peroxidation risk that we would see from some of the omega-3 content. So I think the best strategy overall is, incorporate the seafood options that we mentioned. And I would look towards some of the plant compounds and things like this to modulate the inflammatory pathways without necessarily driving a risk of lipid peroxidation from high dose fish oil. This is a little bit tangential, but I used to have to open up the fish oil pills when I had patients who were in comas because they would have feeding tubes, and I'd have to put it in the feeding tube. And the smell of those fish oil pills was absolutely terrible. And even these are the special ethyl ester fish oil. It's it's disgusting, so disgusting. If you got it on anything, it would smell for days like fish in the room. And it's definitely, I don't know if it wasn't in a pill. I don't know if anybody would take it.
Yeah, it's pretty bad. I wanted to say also, when it comes to tox inhibitors and reducing the production of the inflammatory icosanoids, aspirin is normally something that is really helpful here. Normally would be top of the list. We do need to be careful with it in any sort of acute brain injury because of the bleeding risk. So that's something to be aware of. But if the injury is not acute, depending on the stage, depending on what's going on, it might be something that I would have on the radar as well.
Yeah. Okay.
All right. So moving on to the last question here. Got a question from Deb, who says that she would love it if we would do a podcast about drinking alcohol from the bioenergetic view. So we talked a bit about alcohol in the Fatty Liver series, which we talked about a lot of other things there as well. Obviously, that was a pretty extensive series. We'll just talk about a few of the clearest concerns when it comes to alcohol, just kind of talk through those briefly. And we'll also talk about strategies, things that you can do if you are going to drink alcohol to mitigate the negative effects. But as we'll kind of get to, I think it's a situation where less is better in general. So if you can avoid it entirely, that's best. But if you're not going to do that, then here are some strategies that you could try to help mitigate any negative effects. So the main concerns that I would say were that there are when it comes to consuming alcohol, I would say there's kind of two categories. On one hand, we have the effects on the gut, and on the other hand, we have the effects at the liver. And so when it comes to the gut effects, one thing that's been shown pretty universally is increases in intestinal permeability, pretty significant ones. However, it's worth mentioning that this requires a pretty decent dose of alcohol in most of the studies to create that effect. Of course, there could be lower amounts of intestinal permeability with lower amounts of alcohol consumption, so it's worth considering. But so that's one concern. The other is a shift in terms of the microbiome, where, again, in large enough amounts, it's been shown to increase the growth of harmful bacteria, increase fungal growth, reduce microbial diversity, all sorts of things that are associated with basically negative outcomes in terms of the gut microbiome. And it's also been shown to directly increase endotoxin production and increase nitric oxide, also both things that we've talked about quite a few times in the past being harmful. So basically, that's one main area where alcohol can cause its effects. And we talked about this in the fatty liver series, but if you provide antibiotics when providing alcohol to the rats, it really mitigates a lot of the damage done by alcohol. We aren't going to suggest that you take an antibiotic every time you drink, but there are other things that you could try that will help mitigate the gut effects that are maybe not quite so extreme as that and don't come with some of the possible negatives. So that's on the gut side. And then there are some direct negative effects at the liver when it comes to alcohol. And we see basically clear increases in oxidative stress. We see interference with the metabolic state where there's a reduced NAD plus to NADH ratio. There's ATP depletion. And there's also the production of harmful intermediates like aldehydes. And these contribute to the damage and oxidative stress and whatnot. And so that's the other area that we want to be concerned. And if in a number of the studies, when they look at the presence of PUFA or the consumption of PUFA versus saturated fats alongside the alcohol, if you are consuming the PUFA with alcohol, it has way worse outcomes versus consuming the saturated fat, which is very, very protective against the negative effects of PUFA. And we've gone through some of these studies before by Nanji in that fatty liver series and elsewhere. So I'll link to those episodes. But so those would be kind of the main concerns we have when it comes to alcohol. And for each of these concerns, there's different things that we can do to help mitigate the effects. Before I get to that, I'll let you jump in, Mike, with any other possible negative effects from alcohol, or feel free to jump in with some ways and strategies to mitigate the negative effects.
Yeah, I think I agree with the major effects of alcohol, right? So you have the depletion of ATP, you have the hypoxia that it produces, and then you have the acetaldehyde. And I think that the biggest problem is really the endotoxin, because you see the studies where you have the germ-free mice and they get fed alcohol and they don't go to cirrhosis. But then you give them some bacteria in the gut and it's like, now we're getting cirrhosis. So you just kind of get a fatty liver normally with just alcohol by itself. And so I think endotoxin is underrated as one of the biggest problems with the alcohol consumption. The other thing is that I want to just mention here is that the chronic upregulation of oxidative stress, then acetaldehyde, and the lack of ATP and damage to the liver actually drives damage to DNA, which drives liver cancer over the long term with alcohol consumption. So I think the number one strategy across the board with alcohol is just avoid. If it's in your supplement for a tincture or whatever, fine. But to drink on a regular basis, I would just avoid. The other thing I would say is a lot of people say, oh, well, red wine has all this benefit and yada, yada, the polyphenols. And it's like, yeah, the polyphenols from grapes are great, but just have, you can have purple grape juice too, or you can have pomegranate juice or things like this. So I would shift into those. And the other thing I would mention with the alcohol component is that if you are using alcohol for its GABAergic and dopaminergic properties, there are other things that you can do. So you can make a concoction with something like a grape juice and a pomegranate juice, and then add things like taurine and glycine and L-theanine and maybe some herbal compounds like valerian and lemon balm and skullcap that will calm you down, help you relax at the end of a hard day, and all have health benefits without blowing your liver up and causing a variety of intestinal issues over the long term. And the other thing that alcohol is really good at doing is depleting minerals and vitamins, like smashing your magnesium levels down, and then also lowering B vitamins pretty significantly. When I was working in the ICU, every person, depending on when I was in Albuquerque, it was like tons of alcoholics coming in on a regular basis, having to withdraw from alcohol or being in liver failure or things like this. And the protocol was always, they need magnesium, they need thiamine, they're going to need banana bags, which is a bunch of B vitamins called banana bags because the B vitamins turn it yellow. And so we're giving them banana bags, we're giving them fluids, we're giving them potassium, we're giving them magnesium, and then we're giving them benzos to help them, things like Ativan, to help them to not have seizures and stuff when they detox off the alcohol and get bad tremors and really high heart rates and things like this. And so that depletes a ton of vitamins and minerals. And over the long term, this is pretty bad for other organ systems as well. Another common thing that people don't know about alcohol is that it drastically upregulates iron storage and absorption. And so I've had a couple people who were carnivore and they had some alcohol while they were carnivore, and then they came with pretty significant iron overload that we then had to troubleshoot that. So I would be very careful, especially if you have any risk of hemochromatosis, of drinking on a regular basis and consuming lots of meat, because your risk for iron overload is going to go up pretty high, especially as a man. So these are things I think are important context to understand. In terms of dealing with alcohol, there's the acute effects of it, like how do you deal with it acutely, and then the long-term effects of rehabbing the liver and the intestine. And so acutely, there's some things that are super helpful. Like if you're going to drink, because a lot of people, it's a social thing, I get it. Then the option to do is, number one, I would say have fruit and some type of saturated fat source before you drink. So you could have some berries and some chocolate with a glass of juice. So I would do something like that because the fiber polyphenols protect the microbiome. The saturated fats from the chocolate will help to protect the liver, as well as the polyphenol compounds and things like this. And then the other thing I would do is I would have collagen and whey protein. The collagen is going to provide amino acids to protect the intestinal lining. And then the collagen plus the whey are going to provide the amino acids glycine, glutamate, and cysteine that will make glutathione, which is like one of the major important components to make in the liver to deal with the reactive oxygen species of alcohol, and alcohol can deplete glutathione. The other thing is to recycle it. You would want to have things like vitamin E and vitamin C. Another thing that can be helpful is while you're drinking, or around the time that you're drinking, magnesium and a little bit of calcium can be helpful as well to protect the stomach from the irritation. And then if you had like a zinc carnosine or something like this would also help to protect and rebuild the stomach lining and intestinal lining from the ulceration that alcohol causes. The last couple of things I'd mention is glycine, taurine, and B vitamins would be very helpful to help the liver to metabolize the alcohol directly. And then there's two compounds. One is called metadoxine, and the other one is called dihydromercidin. And they can help with the metabolization of alcohol when you drink, to help the body like process it much faster overall. So these are the strategies that I put in place, even acutely, but long-term, it's the same thing. And another one that'd be important long-term would be adequate amounts of something like choline to help manage the fatty liver that alcohol will provide. So maybe like a phosphatidylcholine or a CDP choline, something like this, in conjunction with B vitamins, mag, the vitamins and minerals to basically replete the nutrients that have been depleted with the alcohol. So this is a huge stack. The number one downside of this stack is that you will have a hard time getting drunk, especially if you use metadoxine, B vitamins, the sugar, and then also the dihydromercidin. So I would say number one strategy across the board, do not just avoid drinking as much as possible. These are some options if you're going to drink a small amount socially or whatever the thing is. And then if you're dealing with chronic alcoholism or something like this, these would be strategies that I would start to put on board, pretty quickly, as soon as even while you're drinking and when you stop drinking in the meantime, to help get the system recover. Because again, multiple areas get destroyed: nutrient deficiencies, gut degradation, liver degradation, oxidative stress, all this type of stuff, microbiome disruption. It's pretty negative overall.
Yeah. The other negative with that stack is you have to bring your whole supplement cabinet with you, or to the bar or business event. So.
Ideally, you would do this stuff the day the morning before you could get some of these things on board. The metadoxine and the dihydromercidin would be the strategies to do there, and then having some fruit and some chocolate. So those would be the things I would do at that time, but everything else would kind of be just around before or after the person had the alcohol.
Well, and if you're going to go to that length of using those compounds to degrade the alcohol and whatnot, why drink in the first place? That's, just get something that looks like a drink, right? Get a sparkling water or something. And what, at that point, what's the difference between those two things? So yeah, a couple of things that I wanted to come back to kind of wrap up. And that kind of with that last comment, the first is the idea of needing to drink, I think, is obviously an aspect of culture in mostly the Western world, but also kind of elsewhere as well. And one that just because it exists doesn't mean we need to go along with it. We talked a lot about culture. We had a few episodes about it and our thoughts on it and different considerations. And so I'll just link back to those. I think this would just fit in there, right? And obviously a lot of things we do for our health are directly in opposition with what is normal, common, considered to be maybe healthy, quote unquote, in the culture. Just because letting loose is considered to be healthy doesn't mean it actually is, just because, there's all the different iterations there. So I think I would just challenge that. If you are someone who is drinking for those reasons, maybe that's something we want to reconsider, just think about in a little bit more detail. The other side, and you alluded to this too, is using it as a coping mechanism for stress, for issues in relationships, for other maybe mental health struggles. And there's a place for Band-Aids. If we're going to use a Band-Aid, I would way prefer to use one that doesn't have these sorts of negative effects. But if this is our Band-Aid of choice for one reason or another, we obviously want that to be as temporary as possible, right? And that we actually work on those underlying issues so we don't need to rely on it as a coping mechanism. So that's obviously a much larger conversation and would depend on what specific reason we're using it, but those are really important when it comes to alcohol use. And then just a couple other things to mention when it comes to things to consider in terms of mitigating the effects. So fructose, and you mentioned, carbohydrates and fructose alongside it. Fructose is able to double the clearance of alcohol. So that's something that you could get pretty accessibly and use. Another one is taurine, as you said, which also improves alcohol clearance and detoxification. So get an easier one to acquire and use. As you mentioned, saturated fats are also very protective here. They can protect against the gut effects and the liver injury effects. So something that, again, if we're generally consuming them, should be there. And B vitamins are a great one, as you mentioned. The last thing, which I don't think you mentioned, was activated charcoal. That's something you could use later on, like after the consumption of alcohol. If you use it with the alcohol, it'll prevent its absorption, which you could do. But you could also take it later on and still, even after it's absorbed, help to protect against some of those gut effects. So that would be something I would consider as well here. But, and the last thing, when it comes to like the long-term issues here, we're talking about healing up a liver that's damaged, inflamed, potentially fatty, all of that. And I would take a look at all of the recommendations and strategies we mentioned in the NAFLD podcast series. We spent a lot of time going into the mechanisms, pathways of what's going on in those states, but also at the end, we spent a lot of time talking about supplements and diet and other things to incorporate for long-term liver health and, in the state that we have chronically damaged the liver. So yeah, and all great points there. You mentioned, nutrient deficiencies, things like that, which I think are important to consider. And you also mentioned, I think, the most important thing here, which is that less is more. And if we can avoid it, that would typically be the best option. So we'll wrap up there. Mike, can you share with the audience where they can find you?
Sure. So they can find me at mikefave.com and also at my YouTube channel, Mike Fave.
Awesome. All right. Well, I hope you guys enjoyed that episode. If you did, please leave a like or comment. If you're watching on YouTube, if you're listening elsewhere, please leave a review or 5-star rating. Those things really do a lot to help support the podcast and are very much appreciated. As always, to check out the show notes for today's episode, where you can take a look at the studies and articles and anything else that we referenced, head over to jfeldmanwellness.com/podcast. And if you're looking to optimally support your metabolism, lose weight, improve your digestion, improve your liver health, get amazing sleep, rebalance your hormones, boost your energy, and so much more, alongside or with clear action steps and strategies and personalized guidance from me, head over to jfeldmanwellness.com/solution, where you can find all of the information for the Energy Balance Solution program. This program includes customized health coaching, a video library with videos on regulating blood sugar, restoring gut health, strategies for weight loss without destroying your metabolism, how you can rebalance your hormones, get amazing sleep, and tons more. It also includes resources like a sample meal plan and supplement guide and a private community. So again, head over to jfeldmanwellness.com/solution to check out all the details. And with that, I'll see you on the next episode.